The cardiovascular disease results in death of 20 million individuals worldwide annually.
In our clinical practice of last many years, we have seen and observed a change in the pattern of cardiovascular disease. It is not uncommon now to observe a young patient with a heart attack in emergency. It could be a man or it could be a woman.
ये कहा जाता है कि तालू से नाभि फ्रॉम पैलेट टू नेवल, आगे या पीछे, लेफ्ट या राइट, कहीं भी पेन हो वो चेस्ट पेन हार्ट अटैक का हो सकता है।
कुछ लोगों में हार्ट बीट की इरेगुलरिटी या स्किपिंग ऑफ हार्ट बीट टाइप के सिम्टम शुरू हो जाएं तो उसको भी निग्लेक्ट नहीं करना चाहिए। These should be taken as early warning signals and early medical attention should be sought.
Namaskar and welcome to today's podcast session on heart disease prevention in young population. As we know, heart disease continues to become a major healthcare challenge worldwide, and this concern is growing among young population. Today, we will explore why this is happening and what measures can be taken to safeguard young heart. I am Dr. Amit Malik, Director Interventional Cardiology and Electrophysiology, Medanta Hospital, Noida, and joining me today, our distinguished expert panel, Dr. Rajiv Mehrotra, Director Clinical and Preventive Cardiology, Medanta Hospital, Noida, Dr. Girish Vaishnava, Director Internal Medicine, Medanta Hospital, Noida, and moderator for today's session will be Dr. Waseem Farooqui, Consultant Interventional Cardiology, Medanta Hospital, Noida. Together, we will explore that what measures can be taken to safeguard young heart. So now I'll request Dr. Waseem Farooqui to proceed for the session moderation.
Thank you, sir. Hello, everyone. So, as we all know that we are all gathered here to discuss about this important issue of the rising incidence of heart attack in young generation. The cardiovascular disease results in death of 20 million individuals worldwide annually, and the incidence is rising in young generation. This trend is a major concern for all of us. So we have all sitting down here and we shall discuss then what is the reason why this is happening and what shall be done at the earliest to prevent it. I shall start by asking first Dr. Malik sir. Please tell us sir, this rising incidence in younger generation, is it reality or just a media hype?
This is reality. There is no media hype. In our clinical practice of last many years, we have seen and observed a change in the pattern of cardiovascular disease. It is not uncommon now to observe a young patient with a heart attack in emergency. It could be a man or it could be a woman. As per the data, there are about 40% of the heart attack patients are below 45 years of age in India. This is a major concern.
So 40%, sir, is a really big number that should warn all the youngsters and they should all be aware about it. Now, moving ahead, let me ask Girish sir, can you please tell us sir, what are the common symptoms that you come across which are usually seen nowadays because in heart disease?
There can be no symptom. You can just collapse. So, especially in diabetic patients, it's a silent heart attack, and you can come in sudden cardiac arrest. You must have seen that, recent episodes in celebrities in the age group of 40 and 50s doing treadmill and collapsing, and that is sudden cardiac arrest. And the typical symptom is chest discomfort, chest pain. But in general saying, ये कहा जाता है कि तालू से नाभि फ्रॉम पैलेट टू नेवल, आगे या पीछे, लेफ्ट या राइट, कहीं भी पेन हो वो चेस्ट पेन हार्ट अटैक का हो सकता है. तो द अर्लीस्ट सिम्टम ऑफ हार्ट अटैक, इफ यू हैव family history, you are obese, you have diabetes, hypertension, and if you get this kind of pain, you should consult your cardiologist as soon as possible. And there can be shortness of breath, and you can have, while walking and doing your regular exercise, you can get pain in the jaws and shoulders and chest pain. These are the normal symptoms.
So practically symptoms सिर्फ chest pain नहीं होता, बहुत सारे symptoms हार्ट के हो सकते हैं, सब पे ध्यान रखना बहुत ज़रूरी है, दर्द होना ज़रूरी नहीं है. Now going ahead, let me ask Dr. Rajiv Mehrotra, sir, are there any warning signs or symptoms which one should look for in the younger generation before they should come to a conclusion they should think that they might have heart disease?
You see, the population which we are talking about, the younger generation, and as Dr. Vaishnava has already explained, many of these patients, or a large number of these patients, do not have any symptoms at all. And a cardiac arrest or a heart attack would be the just first symptom. But there are a lot of patients who do have slight symptoms or some early warning signs which are usually neglected by them, maybe ignored as or neglected as a gastric pain, some sort of a chest pain which is thought of as a gastric pain, या बहुत से लोग सोचते हैं cervical spondylosis या muscle pain हो सकता है. तो मेरी सलाह ऐसी है कि इस तरह के साइंस, या फिर बहुत से लोगों को यूजुअली एक्स्टम्ड एक्सरसाइज से लेस एक्सरसाइज पे अगर इस तरह का कोई चेस्ट पेन, ब्रेथलेसनेस या कई बार गिडनेस ऐसे सिम्टम शुरू हो जाए, या कुछ लोगों में हार्ट बीट की इरेगुलरिटी या स्किपिंग ऑफ हार्ट बीट टाइप के सिम्टम शुरू हो जाए, तो उसको भी निगलेक्ट नहीं करना चाहिए. दी शुड बी टेकन एज अर्ली वार्निंग सिग्नल्स एंड early medical attention should be sought.
Yes, sir. Like every disease has got risk factors. So, Dr. Girish, आप please हमें बताइए कि in your vast experience, in your practice, what risk factors do you come across in today's individuals?
See, I blame it to stress only. Stress is one of the commonest cause of all the heart attacks, especially in younger individuals. And the stress starts. So what it does, there is a lack of sleep. You are not sleeping well, so you don't get up fresh in the morning. If you don't get up fresh, then you don't do any exercise, so you start gaining weight. And then, there is increase in fasting blood sugar, then hypertension, then cholesterol, and then you get into that triangle of diabetes, hypertension and cholesterol, and you are prone to heart attack. So physical inactivity, increased weight, number 2, your lack of sleep and stress. Your lifestyle, it's a lifestyle disease, and it's a very important factor that your tension जो बोलते हैं हम, जो तनाव, मानसिक तनाव, उससे बच के रहना है, उसको negativity को ख़त्म करना है, and we have to think positive if you want to prevent heart attack from happening. That is the most common risk factor. And the diet, what we are eating, it is another important factor, where how much we are eating, when we are eating. So our daily routine has to be disciplined, and we have to have a regular routine, what time we sleep, what time we eat, and what time we get up, and we must find at least 1 hour of our daily routine for regular exercise.
Very well said, sir. इसका मतलब है रिस्क फैक्टर्स अगर हैं तो डिजीज होने की आशंका हो सकती है. बट डॉक्टर मलिक, व्हाट अबाउट वी आर ऑब्जर्विंग नाउडेज दैट यंग इंडिविजुअल्स, दोज हु आर apparently healthy, now having heart attack. So can you please explain about those individuals? What are they suffering with? What are they dealing with?
Yeah, very important question, Dr. Waseem. Nowadays, we are hearing a lot of young people, they get collapsed in gymnasium or marathon or doing exercise. As Dr. Girish Vaishnava explained and Dr. Rajiv Mehrotra about the risk factor of heart attack in young population. But that looks can be deceiving, and many of these apparently healthy individuals may be harboring these risk factors, but they have never been screened about it. So, important message is that get yourself checked regularly, especially before involving in gymnasium or strenuous physical activity. Know your risk factor and then proceed accordingly.
Thank you, sir. So, Now I shall ask Dr. Rajiv Mehrotra, can you please tell us, sir, that what is the importance of screening in heart disease?
Yeah. Now, specifically, we are talking about the heart diseases in the young. So, I would say that the prevention strategies should begin at a very, very young age, maybe at the school level itself. हमारा एम होना चाहिए कि हम इन हाई रिस्क यंगर पॉपुलेशन को स्कूल एज में ही डिटेक्ट करने, अर्ली स्क्रीनिंग करके. Best strategies would be to catch them young. Maybe we screen them for physical inactivity in the school, their dietary habits. We should have them weighed. जो overweight बच्चे हैं, जिनकी dietary habits खराब हैं या जो physical inactivity में रहते हैं ज़्यादा, उनको हम pick up करके उनमें हम कुछ interventions follow कर सकते हैं. So this would be picking them young and then intervening. In the age group of adolescents या younger adult population में regular screening is very, very important. I would suggest that all of these people should be regularly have their blood pressure checked, their blood sugar levels monitored, and their cholesterol levels also checked at least once in a year. If we find high-risk individuals based on these checkups, or those patients who have a strong family history of a heart disease, should be intervened at an early stage. So, इनमें से अगर हमने कुछ पेशेंट्स को पकड़ा जो हाई रिस्क हैं, उनको फिर हम आगे के टेस्ट भी एडवाइस कर सकते हैं, जैसे ECG हो गया, एकोकार्डियोग्राम हो गया, स्ट्रेस टेस्ट हो गए. Like Dr. Malik said, stress test may be a very, very useful test in those patients who have to join a gym and start some rigorous exercise protocols and all. In many patients who fall in the high-risk categories, we may also advise certain tests like coronary calcium scoring, or maybe in advanced stages some CT angiogram and also all these tests. So one size doesn't fit all, लेकिन हमको screening process एक younger age से definitely शुरू करना चाहिए, जो कि school age से ही possible है.
बिल्कुल सर. तो सबसे पहली चीज़ है, पहले अपने रिस्क को पहचानिए, फिर बीमारी के बारे में और आगे मालूम करिए. So, Dr. Malik, once a person is aware of the risk factors, how should that person proceed next? What should be done?
So, जैसे अभी तक की बातचीत से ये क्लियर है कि lifestyle modification plays an important role in prevention of cardiovascular disease. जैसे डॉक्टर गिरीश ने बताया, mental stress, irregular physical activity, these are the major challenges in young population. So, lifestyle modification will be the key in prevention of cardiovascular disease. और मैं दो बातों पर ज़्यादा गौर देना चाहूँगा. That monitor your body weight, number one, and number two, stay active as per your physical abilities. Reduce your screening time and reduce your sedentary activities.
So now, a lot of people do exercise. Some people exercise for minutes, a couple of like half an hour, and some people exercise for hours altogether. Is there any practical approach or guideline about exercise?
So yes, Dr. Farooqui, there are recommendations from guidelines, and it is recommended that about 150 minutes of physical activity per week is recommended. But it's not a rule of thumb. One should know his or her physical ability and proceed accordingly. Very important part is that try to stay as active as possible and reduce your screening time. As Dr. Vaishnava said, that mental stress is very important risk factor. So try to involve some meditation and yoga practice in your daily routine activity. And try not to do that from 0 to 100 km in 60 seconds. That doesn't apply to your body. So start slow and achieve your target gradually.
So in a nutshell, active lifestyle should be the aim. So coming to Dr. Girish now, sir, diet has always been a very important concern for the patients as well as caregivers. So what is your practical approach about the heart disease and diet? How do you go about it, sir?
See, we have to balance our diet according to our physical activity and weight. The problem with the younger generation now is that fast food, free home delivery, they can get food any time of the day and night, and they don't have any fixed timing for dinner. You know, if you ask patients who are more 80 plus, 80 years plus, the octogenarians and nonagenarians, then they have a disciplined life. They eat breakfast at one time, lunch and dinner, and then sleep for 7-8 hours. Now the younger generation, they eat all junk food. They eat less of fibers, less fruits and salad. We should increase these fibers and green vegetables and fruits in our diet, and balance it. Carbohydrate should be around 50%. Our diet contains 70 to 80% of carbohydrate. All these junk food are full of carbohydrates, full of fats. To keep your carbohydrate, eat complex carbohydrates which are rich in fiber. Keep it around 50%. 20%, around 20% is your fat intake, and protein intake should be 30%. You should eat more of proteins. And younger generation, they are going to the gym and eating junk food. It doesn't help. It will add to your weight and fat content. Avoid simple carbohydrates, go for complex carbohydrates, go for proteins, go for high fiber diet and lot of fruits and vegetables. Then you will see that your diet is maintained. So please eat in time. Nighttime snacking adds to your weight gain, and it affects your sleep and indigestion. And I have seen that we see all these patients with high acid formation, hyperacidity, irritable bowel syndrome, and constipation with these junk food is very common. Earlier we used to eat so much fibers that constipation and again colonic diseases, colonic cancer was very less in our country, but now it is the increasing incidence.
So eat healthy and eat on time. So one more important issue for Dr. Malik, it is said that young females, they have a natural history or some protective factors given by the nature so that they can have less disease, heart disease, in comparison to the male factor or male gender. Sir, how far does it hold right?
This is very important in today's scenario. The heart disease is #1 killer among women. And I would like to share few facts that if a lady smokes, she will have 4 to 6 times more risk of getting heart attack than his or her counterpart. And if a lady who smokes and is on oral contraceptive pill, the risk of getting cardiovascular disease is about 30 times. Diabetes also play an important role in female, and it increases the risk of getting cardiovascular disease about 4 to 7 times. So it is not right that if you are young, you are naturally protected by your hormones. If you are having these risk factors, getting chance of cardiovascular disease are very high in female.
Thank you, sir, for sharing such knowledgeable facts. So now we have had a very interesting and a very insightful session on the incidence and rising disease of heart in the young individuals. Now I'll ask Dr. Malik to conclude the session by giving a take-home message.
So thank you very much for joining us on today's podcast session for prevention of heart disease in young. Big thanks to our expert panel, Dr. Girish, Dr. Rajiv, and our moderator, Dr. Waseem, for their valuable insight. The take-home message is very clear, that know your risk factor early and manage them timely to reduce the burden of cardiovascular disease in society. So I would like to take a one-line take-home message from our expert panel, from Dr. Rajiv and Dr. Girish, for the audience. Dr. Rajiv.
Well, my one-line message would be that be aware of the rising incidence of heart disease, especially in the younger population. Get yourself screened for any risk factors and get them treated properly at the earliest.
The take-home message which I would like to give you is, मेरा एक वन लाइनर है विच आई रिपीट टाइम एंड अगेन, चीनी, चिकनाई और चिंता से बचें, चैन की नींद सोएं और सुबह चलना शुरू कर दें, तो आपको लाइफस्टाइल डिजीज़ इंक्लूडिंग हार्ट अटैक, हार्ट की प्रॉब्लम होने के चांसेस बहुत कम हैं। दूसरा, डॉक्टरों से डरे नहीं। द मोमेंट यू गेट एनी सिम्टम, any unusual things happening to your body, please consult your doctor. Don't rely on artificial intelligence or chat GPT or social media. They can only guide you. They will also tell you that please see your doctor, but don't get treated by these, because we have seen this happening during COVID time. People came very late and it was very difficult to save them. Early detection, as mentioned by Dr. Amit Malik and Dr. Rajiv Mehrotra, the famous cardiologist, that early intervention is very important. So please go to your doctor and he will help you. Thank you very much.
Thank you, Dr. Girish, Dr. Rajiv and Dr. Waseem. And thank you for joining us today's podcast session. I'm your host, Dr. Amit Malik. Thank you very much for tuning in. Stay aware, stay healthy, and keep your heart safe. Namaskar.